And on the intake side, where you're looking to implement or starting to implement AI agents to escalate to human, what outcomes have you seen or do you expect to see? So like reduced drop-offs or faster bookings. I guess what pushes you, what pushed you guys? I mean, apart from you guys only being six and doing everything and having such an expansive business, but what is the pain point you would like to see drop first when you implement these AI agents to hand it over to a human?
Well, a couple things. Uh, like right now, let's say, a patient has appointment once a week. Let's just say it's Wednesday to Wednesday. Um, uh, then a therapist, I mean, I'm sorry, a patient will keep a journal and they'll write a journal. Well, the last thing, sorry, that a therapist wants to do is, you know, review 7 days worth of journaling. So if AI can take the 7 days worth of journaling and say, hey, here are four things that you need to discuss with the patient from the journaling that we saw, that's going to be a huge time savings and very, very productive. And the other thing, too, is that, AI can help with analyzing the patient. So let's say that, the therapist goes, well, I think that, it's a pretty good chance this patient has depression. Well, um, you know, AI may say, well, yeah, there's an 80% chance that this patient has depression. But also, we found there's a 70% chance this patient has anxiety. And the therapist's like, oh, well, I missed that. And so I'm glad to know that. So now I need to not only address depression, but I also need to address
Yeah,
anxiety as well.
anxiety. Yeah. Okay. Okay. So we've already sort of established that you've got 300 therapists across 43 states. So the question is, I mean, apart from you guys wearing 5 to 6 hats each, but how do you balance capacity, licensure, and specialties? So to the end that the first session is the right session. How do you match up, the therapist with patients? I guess is what I'm asking.
Yeah. So, well, each on the website, each therapist has their own profile and they write maybe three or four paragraphs about their philosophy on therapy and all that stuff. So a patient can look at that. And then I'll also have a category which mental health issues they address, depression, anxiety, or whatever it might be. So they can see that, oh, they do address the issue I'm having. And then some of the therapists, not all of them, a lot of therapists will offer like a 15-minute phone call conversation to see if it's a fit or,
Okay. Okay.
if it works that way.
Yeah. Okay. Okay. Makes sense. And what's your current playbook for reducing no shows and late cancellations? Do they still happen? Sort of no shows?
Yeah, they still do. A couple of the EAPs they actually pay for no shows. It's not at the full rate, but it's usually 50%. So that's helpful. But a lot of them don't. If a patient keeps missing therapy sessions, then a therapist can report them to the EAP and say, hey, listen, they've canceled 3 times now, and this can't continue on. And they'll have a discussion with the patient. The EAP will say, hey, you set these appointments, you need to make sure you make them or whatever type thing.
Yeah. Okay. Okay. And if, for example, hypothetically, I flew to Denver, and I shadowed you guys for a week. In terms of your ops, what workflow still feels the most manual to you? Is it so for eligibility checks, billing, onboarding, outcomes reporting? Which one feels the most manual to you guys at the moment?
It's still filing insurance claims. I mean, it's so antiquated, and sometimes with insurance claims, if there's 3 things that are wrong with the claim, the insurance company will tell you one thing, but that you correct that, but they won't tell you the second or third thing till after you've done, something. So and some people say they purposely do it that way so they can delay paying the claim. And there's programs and services out there that are better about coding for billing that will alleviate a lot of rejection, initial ejections, and all that stuff. So I think AI is going to play a bigger part of that and take filing a claim, especially with insurance companies, with having AI kind of check it. So it's going to be fewer and
Yeah.
fewer rejections.